Hello, and welcome to the Clinical Liver Diseases video series. CLD is an official digital learning publication of the ASLD. I'm Somaya Albhaisi, an assistant professor of medicine at VCU and the author of the article titled, Does NAFLD Increase the Risk of Extrahepatic Malignancies? NAFLD is a clinical pathological entity that encompasses a spectrum of disease severity that ranges from simple steatosis to NASH and cirrhosis. NAFLD is now the leading cause of chronic liver disease worldwide, with the highest prevalence in many high-income countries. It is strongly associated with the metabolic syndrome. It is associated with a significantly higher mortality because it increases the risk of end-stage liver disease, hepatocellular carcinoma, as well as non-liver-related and all-cause mortality. The majority of deaths among individuals with NAFLD are attributed to cardiovascular disease and malignancy. Thus, there has been an increasing interest in further investigating the role of NAFLD as a potential important driver of extrahepatic diseases. Extrahepatic malignancy is the second most common cause of death in patients with NAFLD. The highest risk was noted in colorectal, gastroesophageal, pancreatic, biliary, breast, uterine, renal, and prostate cancers. A considerable amount of data recognize the role of visceral obesity in the development of various cancers. Evidence suggests that visceral adipose tissue and its inflammation can lead to development and progression of NAFLD. The specific types of cancer that patients with NAFLD are at high risk for, or the magnitude of risk compared to those without NAFLD, is not known. NAFLD may be more important intermediary biomarker of cancer risk. It is not clear whether there are particular characteristics of malignancy risk among those with NAFLD that are distinct from those with obesity alone. In a recent cohort study, the obesity-related risk was largely driven by NAFLD, while obesity in the absence of NAFLD had minimal association with malignancy risk. Overall, a clear understanding of the biological and genetic pathways involved remains lacking because of the close relationships between NAFLD and central obesity, dyslipidemia, and insulin resistance. Future studies should aim to rule out obesity since it is the major confounding factor implicated in extrahepatic cancers, and they should use liver biopsy or at least novel non-invasive modalities to stage NAFLD. On behalf of all of us on the CLD team, I hope you have found this video about risk of extrahepatic malignancies and NAFLD useful. For more information about extrahepatic malignancies and NAFLD, please visit us on www.cldlearning.com. Thank you for watching.